Today, I'm going to talk to you about a taboo topic that nobody really likes to talk about, but a lot of people, both women and yes, also men, we're going to talk about bladder leakage or bladder incontinence. This happens if you've had a baby or if you haven't. There's an assortment of reasons behind bladder leakage or poor bladder function. Today I'm going to share with you 5 factors behind why you might tinkle a little if you laugh, if you sneeze, even if you're washing your hands, or even thinking about water. This video has been requested by so many of you, and I'm really excited to delve into this topic. This is a new playlist, so we're going to be talking about all things tinkling, bladder leakage, bladder incontinence for men and women. All of these factors apply for both genders. So if you're ready to stop the tinkle when you laugh or sneeze, let's kick off today's video. Hi everybody, I'm Dr. Melissa Gallagher. I'm a functional medical doctor, a naturopathic physician, a mom of 1, and I'm not afraid to admit that the state of my bladder strength has greatly decreased after I had our son Gabriel. So I can totally relate to the fact that if you sneeze really hard or you're laughing or even washing your hands, you all of a sudden have an experience of some bladder leakage. This is way more common, and I wish we'd talked more about it, specifically in the medical community. I have never had any of my providers, now I'm going on 8 years, nearly 8 years since I've had Gabriel. I've never had any of them ask about if I'm having any bladder issues or what's the state of my pelvic health. So today I'm tackling the reasons behind why you may experience bladder leakage. If this particular topic is of interest to you, I hope you will hit that like button and make sure you hit that follow, subscribe, hit the bell. Because again, I'm going to be talking more about this and I have a ton of resources. I always love to share what I'm dealing with, what I've discovered is helpful, what I recommend to my patients. So this is very close to my heart. I've been a little hesitant to talk about it, but I definitely know I can help many of you. Okay, let's get started. So the number one reason why men and women have bladder leakage or bladder incontinence is because they have weakness in their pelvic floor. Now, the pelvic floor is basically what we call your girdle, your muscular, your soft tissue, the ligaments and the structure of what keeps everything in place down in the lower pelvic region. So it's totally not uncommon that pregnancy for women blows out the state of our pelvic floor. It actually causes more weakness. Also, if you've had surgery, this could be prostate surgery, bladder surgery, colon surgery. It could be a removal of a uterus or ovaries, even an appendix surgery. Any lower pelvic floor surgery can trigger or create pelvic floor weakness, especially if there was any type of cutting through the pelvic muscles. And in the surgical category, C-sections, they fall in this category. Also age, depending on your age, that can be a factor, and lifestyle. If you're seated a lot, if you're not exercising or strengthening your pelvic floor. So that's number one, that is a leading cause, and I'm gonna be talking a lot about exercises, lifestyle, diet, all sorts of things pelvic floor related in future videos. Number 2 is a very common but extremely underdiagnosed and undertested reason, and it is low vitamin D levels. I will be posting a video here in the next few weeks about vitamin D and bladder leakage specifically. But know this, vitamin D deficiency and any level below 84 on your D3 values is considered deficiency. Vitamin D deficiency weakens muscle tone, and it also puts men and women at greater risk for UTIs. That combination, weak muscle tone and infection and inflammation, boom, guess what? You have a weakened pelvic floor and a state where you're going to have more propensity to have bladder leakage. Number 3 is actually driven by insulin excesses and imbalances in your blood sugar. I can talk a lot about this, but basically insulin and your blood sugar can trigger a heightened bladder state, and that can lead to bladder leakage. Number 4, this is definitely never addressed by doctors. God forbid we talk about your pooping and your constipation or IBS or your bowel movements. But the state of being constipated, especially chronically constipated, and the overall state of your bowel health has a significant influence on placing pressure on the bladder. And it's not uncommon that before men and women can empty their bowel, they have to urinate first. And so that alleviates the pressure and then the bowels can move. If you have constipation, and let me just clarify, constipation is considered when you're not having 2 to 3 bowel movements a day. Even 1 bowel movement a day, you're constipated. The most optimal bowel movement state is you pass contents, you have a bowel movement 20 to 30 minutes after you eat food. Well, I know that a lot of people, and I consider myself in this category sometimes, you're not always eliminating your bowels as frequently as you're eating. So just know that if you do suffer from chronic constipation, it's a state of that bowel expansion and contents placing pressure on the muscles, so the pelvic floor and the tone of the bladder muscles, and pressing on the bladder. So that's definitely something very easily treatable and something you can address. And then my last and final, this is both men and women, the state of your uterine health and your prostate health. If you have a uterus that is filled with polyps and fibroids or thicker endometrial lining, or you have endometriosis, that uterine health can influence the bladder leakage, because the bladder and the uterus, they're all interrelated. So they're sitting in very close proximity and one affects the other. Now for men, the state of your prostate, it's just below the bladder. Your prostate, when it's inflamed, affects your bladder. It affects your bladder volume, it affects the bladder control, and that has a significant role in the state of bladder leakage. So these are 5 reasons why you might tinkle when you laugh, or notice that you've got a few drips of urine just kind of randomly, or even feel like there's urine in your urethra. And it might not be coming out, but you definitely feel like, oh my gosh, that is not my bladder. So I am really excited. This is our preliminary, our kickoff video to this topic. I also have some resources I'm going to be sharing. I'm going to share with you a therapy next. So make sure you follow along and also follow this playlist. I have a video that I'm going to be sharing, a technique, a tool, something that is wearable that you can actually improve the strength and state of your pelvic floor. I'm also going to have some video content about Kegels, how they can actually not be as effective, especially if you're doing it on your own and not with a pelvic floor therapist. We're going to talk about therapy, physical therapy, all that good stuff. So I'm going to be tackling all of the 5 reasons and causes of bladder leakage in this video playlist. So I'm really excited by this particular topic. I know that it's a dicey subject in terms of just not wanting, who wants to talk about it? And who also wants to talk about that you have to wear a little sanitary pad because you're nervous that if you're washing your hands, you might have a little bit more urine that just isn't contained by your underwear. I get it. I get it so immensely that I really want to help all of you who are dealing with bladder leakage. This does not have to be a permanent state. I can speak to the lack of permanence that I now experience with this. I want you first to know it's okay. Talking about it and being aware and also being educated is very powerful. And now we can talk about tools and resources that you can deploy to strengthen up the state of your bladder health and minimize the leakage and incontinence. So I'm really excited. I hope you are too. I hope you hit that like button. So make sure you follow along as we talk all things bladder health, bladder leakage, tinkling when you laugh and sneeze, and really we're gonna get you in a better state of bladder health. I'm so excited. I'll see you on our next video.